Okay, good afternoon. As an introduction, I would like also you to understand that even most of the country, drug use is illegal. So when we find somebody or we get to understand somebody is using illegal drugs, first it is a trauma. We fear he or she is a criminal, or he is immoral, or she's immoral, or she's not supposed to be somewhere or to get something. So that is the experience people who are using drugs, they are living. So for women who use the drugs, it is very, very high risk and very challenging, the experience in their life of drug using. So in the abstract title, Across a Look, we have to understand that there are a lot of challenges that women who use and inject drugs face in their daily life, especially when they are pregnant. And you must find that in our sub-Saharan African countries, most of our program, harm reduction program, are not gender-based according to the needs and the requirement of women who are using and injecting drugs. So you might find most of the women who are using or injecting drugs, they HIV positive, and some they can't take care of their children to the economical, homeless, or stigma, or any harassment they experience from their daily life. So this was the, activity harm reduction program implemented in Dar es Salaam in one of the NGO called HACFU, which were doing outreach services, and when they get education to, especially for women who use the drugs, because we have peer educators who are women and those are men. So for women who use the drugs, we encourage them to reach their fellow women. So during the outreach, they reach some women who use the drugs and refer them to different medical, legal, and other social services. So the NGO was established in 2014. So the background, as we understand that most of women who use the drugs, especially those who are injecting, they're in high risk of getting HIV and other blood-borne infections. For example, they're in a very high risk due to unsafe sex and unsafe injection. You might find this woman who uses drugs is unemployed, is homeless. He has been stigmatized or chased away from the home or from the intimate or husband. So what she can do to get maybe some income, she has to do sex work. And most of women who use the drugs, who are doing sex work, they do very cheap because, as you know, their appearance, they are not maybe good looking, and they are suffering for addiction. They have no any treatment. So you might find they experience a lot of challenges in their daily life, whether they are looking for money or in just looking for health services. So they start all this abstract concern that the research conducted in Dar es Salaam to understand the HIV prevalence among people who use the drugs. And for women who use the drugs, it was found that about 60.7% for women who injected drugs were HIV positive. And for women who use the drugs, which it was low, it was about 40%. And as I said earlier, women who inject are in high risk due to injection and self-injection and unsafe sex. You might find that these women who inject drugs, sometimes she cannot inject herself. She has to look for a male partner who is injector and ask him maybe for a shot, or they can share the syringe or any other kind of materials they use for injection. So they become more at risk. For example, if she went for sex work and it doesn't get any money, she has to wait that male partner to inject and then remain some medicine so that she can inject herself. Or doing sex work, either they cannot negotiate safe sex due to their appearance, or maybe low cheap to be paid, so then, or sometimes they need just money because of the addiction or withdrawal they feel, so that at least they can get something to cool down their withdrawal symptoms. So during the outreach, the peer educators reach about 28 women who use the drugs in their hotspot, brothels, and some hangout they are founding. And this about 24 women were referred to different services. So some of them, they were referred to medical services. And during the referred, when they are reached to the facility, they were screened according to their needs, and some were referred for HTS services. the findings found that during the different medical services they get, and this is the activity was done between 2019 to 2022, and it was found that among of those 24 women who use and injected drugs referred for medical services, 5 of them were found to have pregnancy at a different time, and the others were tested positive, 5. So among those who were tested positive and the pregnancy, 3 of them were found HIV positive, those among 5 women who use and injected drugs. So in their right wrong, when they were going to be followed, because according to the program, when women who use the drug found to be pregnant, you have to be attached to the facility, and to make sure, first you have to choose, because you might find some healthcare workers, some facilities have been trained on how to take care of them, key population or people who are using drugs whenever they access for health services. So during the services, they were found that those women who had pregnant, 3 of them, they got miscarriage at a different time. And when we come to discuss with them what are the challenge, most of the experience the intimate partner violence, and the others, they are beaten by sexual partners when they go for sex work, especially when they demand the amount of money they have agreed during or before sex work. So that has become a challenge. And you might find most of women who use drugs, they do sex work until they're about to deliver a baby. So this is very high risk for them for HIV and HBV incidences. So during the delivery, they were unable to deliver two women who use the drugs, and one woman, is the child of the women who injected drugs, were found positive after 6 weeks when she go back for vaccination and the DBS for her children. When that came back, it was found the baby, she was HIV positive. So when we come to discuss, because she was escorted some of the time to attend the clinic, OPMTC services, and when we came back to realize that the baby has found to be HIV positive, we stay with her and ask what happened, because we tried to follow up her weekly schedule, attend the clinic, or to go for any other treatment, because they were referred also for methadone program, so that at least they can reduce the risk of getting HIV through sex work or even injecting. So when we came to discuss what are the challenges she thought maybe caused her baby to get HIV, first, she says she was experienced stigma and discrimination from healthcare workers. As you know, most of our African countries, healthcare workers, sometimes they rotate, or someone who was trained were not there. So when she went there, she found there are another healthcare workers. So she was not treated properly. So she feels so down. And some women around there who went for clinic services, also they are just avoiding her because of her appearance. Maybe they think she might steal, or she's not good, or she's immoral. So that is what she experienced, she explained. Also, we found that those healthcare workers, most of them were not trained on harm reduction, how to take care of the woman who uses drugs, especially when she is pregnant. So that is a very big challenge to attend, to understand the risky profile and how can support him or to be away or to prevent for further infection. Also, she didn't adhere for the treatment. Due to that time when she experienced that, she didn't go back for the next visit. So she didn't take any medication. It was about 2 weeks. So when we come to realize that, and she said that she was feared to go back again, as the others they hear or they understand the drug use is illegal, so sometimes they hide and fear being go back again, maybe might cause some problems. Also, because of our program, most of the program don't have gender-based harm reduction services for women who use the drugs. So this is a very high challenge for them to get HIV. So the lesson learned after these findings, we found that women who inject or use the drugs should be strengthened by having special hours or conduct outreach special for them. Even if the program is including male, also women have to be their own outreach services, especially for women peer educators to reach their fellow women. Also, budget for sexual and reproductive health services for women should be allocated clearly. Most of our program doesn't have, and women don't have have enough knowledge, especially those who are using drugs, on how to prevent or take care of their health. Also support special centers front for them, especially for women who have children. Most of them are homeless. They're hanging out during the night, during the rain. So this is very hard for them to take care of their babies and prevent some infection. Also empower them on health issues economically, especially because most of them, they do success because they don't have work, and to support their children. And strengthen their capacity on how to prevent and respond for GBV, as they feared, they are drug users, they are immoral, they cannot have power to prevent themselves. Apart from that, also we insisted the training to healthcare workers and police officers, all law enforcers for regularly, so that to avoid this stigma and harassment for them. Thank you for listening.